Be with us, our two speakers who will be with us this morning. I think you'll find this topic very interesting and useful for your practice around coaching trainees in the DEI space. This morning we have two speakers with us. We have Tyra Fainstad, who I think many of you know. She's Associate Professor of Medicine and a member of our division. She went to college at UC Santa Cruz and med school here at CU and did her residency at University of Washington. She's the resident director for the Lowry Clinic's outpatient curriculum, and she has an interest in learner-centered feedback and psychologically safe educational environments. She's a certified professional life coach, and she directs a coaching curriculum for medical trainees called Better Together. If you haven't checked that out, I hope that you'll do that. We also have Dr. Yashika Dooley, who's joining us remotely today. She is assistant professor at the Uniformed Services University of the Health Sciences, and she recently retired as a colonel in the Air Force after 22 years of active duty service. She went to college at Howard University, med school at Harvard, and she did residency in OBGYN at Wright State University. And she did a fellowship in urogynecology at Loyola in female pelvic medicine and reconstructive surgery. She's dedicated her career to help recruit and retain women in medicine and redefine their role as advocates for themselves and their patients. She currently serves as a medical director at a company called Genev. So Dr. Dooley, Dr. Fainstad, thank you for joining us this morning.
Thanks, Brandon.
Thank you.
Okay, I'm going to share my screen, which is the scariest part of any grand rounds. Check done. Okay. Hi, everyone. Thank you for coming. I am Tyra Fainstad over here at Lowry, and we are so excited to talk to you about coaching trainees in the DEI space and what does the DEI space even mean. This is the third time you've seen me in the last 2 years up here for Grand Rounds, and I just really appreciate your attention and continuing to show up for this important work. You are going to hear about Better Together once again. I hope that you recommend it to your trainees. Also, you should know that it's available to all of you through the support of the division. It's not too late to sign up, and we'll talk more about that as we get into it. But I'll let Dr. Dooley introduce herself.
Good morning. My name is Yashika. It's nice to meet you all. And I guess I will just double down and reinforce kind of what Tyra said. The program Better Together really is a safe space, and it allows us to talk about so many things that often we don't have time to talk about, or we don't feel like we always have the words to talk about. And I myself have a coach that I use all the time. So I think it's just very helpful to get that perspective and have somebody kind of walk through that with you. So I would love for you all to try it if you have not already done it. It really can be life-changing.
Okay. Today, we are going to briefly talk about what coaching is and why it's sort of a different hat than what we are used to wearing. We're going to briefly try and understand why we might use the coaching hat, especially when we're helping learners or colleagues, each other, navigate bias and microaggressions and sort of all the isms that we face every day at work. So we're getting into some topics that we don't usually go into deep. Then we are going to learn that coaching tool that if you have come to any of my grand rounds before, you've heard, but I would invite you to come with a learner's mindset. And we're going to specifically go over some cases to use this tool as an adjunct to the other tools that we already sort of at least are familiar with, especially when coaching around bias or microaggressions. So that tool is essentially Metacognition 101, or thinking about your thinking. I'm going to use it in some practice cases. And then finally, at the end, Yashika and I are going to go over some specific tips we have when we are coaching, again, around bias and microaggressions.
So I want everybody just to be really curious and realize that we're going to talk about some cases, talk about the different ways that we view it. But really, you may walk away a little bit confused, and that's not a bad thing, right? we want everybody just to really get comfortable with being uncomfortable and walk away with just having more awareness and just being open to changing the perspective of how you think about situations and how those interactions, different people may walk away with a different perception of those interactions, but that's okay. And really, we want you to know that the magic is going to happen when you step out of your comfort zone and are willing just to question the way that we are thinking about everything. So when we talk about resident mistreatment, there were national surveys between 2019 and 2022 that showed that 45 to 65% of residents report experiencing some kind of mistreatment. And this was often reported more by women and racial and ethnic minorities. And of those, about 59% reported some kind of gender discrimination and 68% racial discrimination. And so I would just say this data likely undercaptures the real prevalence. And it surely doesn't capture all the ways that minority residents kind of experience this exclusion, because oftentimes it can be very slight and sometimes it's hard to actually communicate or capture in words.
Okay, and I'll say those numbers reflect what's going on here at the University of Colorado. That's the data that we heard earlier this year by Dr. Derby and the burnout survey that went out to all of us and our trainees. It probably is actually a little bit worse here at the University of Colorado. Okay, so what we are talking about today is coaching, and I want to really differentiate coaching from the normal hats that you're used to wearing as a medical educator. So I'm going to go through this briefly, but I just want you to consider the fact that you are probably wearing these hats frequently and interchangeably all the time. And unless we pay really close attention to the reason that we're choosing a particular hat, sometimes we can default into the hat that feels most comfortable for us, even if it's not maybe the hat that would serve the learner the best. So when we're working with learners or each other, it's really easy to put on our teacher hat. We do this a lot with patients also. It's basically just an information transfer, right? Somebody has the information and they are delivering it to somebody that doesn't have the information. The hat that I default into the most is called the friend hat. This hat is sort of showing up unconditionally or maybe even radically in someone's corner. This is a super important hat when we're talking about coaching learners, when some form of bias has occurred. This is a useful hat, right? This is a hat that we want to put on with intention and also think about how long we're going to keep it on. So this is like, you know, if somebody comes to me and they said, oh my gosh, I had this supervisor that was just a total jerk to me and I can't believe this happened, and you know they're wanting to vent, and if I'm in my friend hat, I'm looking at them thinking, you're right, that person is a total jerk, I can't believe that happened to you, and you're just believing everything that they say. The problem with this hat is that it's often very hard to move forward from this hat, and sometimes we can even sort of delve backwards and sort of spin in venting, which feels good in the moment but might not feel good in the long run. Here's a hat we're super used to putting on. If you're here at the university, the mentor hat is someone that tends to guide in a direction that they've been. And so usually a mentor is chosen for a certain career path or some other reason that the learner wants to emulate you. And you're this like trusted counsel saying, okay, here's how to follow my path. I've been there before, and let me share how I'll do it. An evaluator, in my mind, that's a certain sector of teaching. It's where we're just observing and then giving our opinion in some form of feedback or guidance. If a learner comes to you with an issue and you default into the evaluator or teacher role without them wanting that, it's much less likely to be received. I don't know if any of you have ever given unsolicited evaluation of, say, a roommate or a spouse and their dishwasher loading techniques. This is one that I fall into often, but if I'm not explicitly asked to share my opinion on the dishwasher, if I evaluate it without that, disaster ensues. And I would offer that this is likely happening on the DL with your learners if they don't explicitly ask also. An advisor role. So this is a really specific part of perhaps a mentor. This is someone who's just giving advice about a specific ask. A sponsor And I want you to sort of be thinking about in the context of a learner who has faced some sort of micro or macro aggression, when you might use all of these hats. So a sponsor is generally someone that lifts up a learner or a colleague. Usually it's when they are not in the room, they're advocating, recommending. The advocate hat is something that I think most of us expect to learn about when we're coming to a talk like this. And the advocate hat is a super, super important hat, especially when we're talking about learners who have unfortunately been in some sort of bias or aggression scenario. It's very important that we have access to the advocate hat. And the advocate hat really is representing the learner in a situation with or without them, and helping them access resources, standing up for them, making sure that, that they have a smooth path in the direction that they want to go. So all of these hats are important. And we are not necessarily recommending the coach hat in place of any of them, but rather in addition. And what I want to name is that the coach hat is generally really uncomfortable for us physicians. So when Yashika and I talk about coaching, we are referring to the act of non-judgmentally showing someone else their mind and then helping them decide if that's the direction they want to go or not. Right? So the tools that we use to do this are generally inquiry. We're asking a lot of questions. We have a belief that the person we're coaching knows what's best for them. So we're trying to tap into that inner wisdom. And that then specifically, we have a belief that we don't know what's best for them. This was incredibly hard for me. I always say when I went through coach certification, coach training, I was essentially unlearning everything that I learned as a doctor. So I was unlearning how to be a doctor. When I'm in my doctor role, or even when I'm in my medical educator role, I have a full belief that I know what's best, that I'm here to help, that I'm here to fix and find solutions. And as a coach, all of that is the opposite of what I'm doing. So it's really uncomfortable for us to step in, but using a coach hat is incredibly powerful. I know this because now I've been doing this for years and years with residents and faculty and APPs and students here at the University of Colorado and across the country. So most of what I'm going to be talking, all of what I'm going to be talking about, and a lot of what Yashika is going to be talking about comes from the Better Together program. This is a program that is completely asynchronous. It's on Zoom. We offer group coaching calls. Over here is one platform that you can get coaching. So these are in webinar format, and we have residents, faculty, APPs, or students come on, depending on the arm that you're in, and get live coached in front of each other. These are all recorded onto a podcast afterwards. And so we are hearing sort of the on the grounds, in the trenches stories of what's going on for our learners and each other. We also offer written coaching where people can write in about issues that they're struggling with at work or otherwise, and we sort of answer on a written forum. We've added individual sessions, and so participants in Better Together can sign up with one of our over 40 volunteer physician coaches at this point. And then the whole thing is guided by this series of worksheets and webinars that are sort of a asynchronous curriculum. Everyone has lifetime access to this. So this is where we're getting our material from. This is why we're here talking about microaggressions, racism, sexism, all the isms that you can think of. I've been running this program for 4 years now. We're in our 8th cohort. It runs twice a year in the spring and the fall. And after each cohort, we look back at all of the questions that have come in, either in group coaching calls or in the written platforms. And we look at those, we have them transcribed, and we briefly put them into buckets with the question, what are our people asking for coaching on? And then we look at our curriculum. Does anything need to be refined? Are we giving the people what they want? What are the common asks? And immediately after the first year, and then shown to us again after the second year, we found that microaggressions and bias at work were one of the most frequently brought topics to us. So we actually now have dedicated almost a whole month and a week that is specifically labeled towards it around this coaching when something terrible, essentially related to an ism, has happened to you at work. And so that is what Yashika and I are here to talk to you about today. Why should you consider the coaching hat? Coaching actually is very effective for helping people in the way that they want to be helped. So I'm sure, we know by anecdotes and our own personal history that all of the other hats are helpful as well. But I just want to say that, when I came to coaching, I always say I rolled my way into it, because when I first heard about professional coaching, it sounded maybe on the same lines as like a fancy life cheerleader or something that wasn't real. And I identified as a, academic Western trained medical doctor. And I brushed it off as a unhelpful tool until I had my first coaching conversation, which completely changed my life, but that's a totally different story. So when I decided to create this program and offer it to residents, I knew that if I was going to get the attention of fellow physicians or people like me, I was going to have to do it in the language that we understand. And since then, here's our main two, or our largest or most widely known two RCTs that we have done. So we studied this coaching program in a randomized controlled trial. In 2021, we ran a pilot here among residents. And then in 2022, we ran a huge national trial in over 1,000 residents across the country. That one was powered to find a difference, and it statistically significantly improved well-being outcomes, specifically burnout, moral injury, self-compassion, imposter syndrome, and flourishing. Every single outcome moved in this trial. We have now completed 3 more RCTs. 2 are in press and 1 is under review, showing similar results in faculty. We did it, which you were all a part of last year. Thank you very much. A CU faculty RCT, which is going to be published next month, an APP RCT with Emory University, and then a 7-site medical student RCT. So it works. I want to offer this to you as a tool that we know works because we've used it, we've felt it, but also we know it because we've ran 5 RCTs that show that it works. Okay, what are we actually doing in coaching calls? We're essentially questioning long-held beliefs and thoughts, or automatic thoughts that maybe the learner isn't even aware of, and just seeing if those are thoughts that are helping or not helping. The one that is very specific to doctors and especially to residents and fellows is this bottom one. The only way to succeed is to be harder on myself, or i.e., in order to do well, I have to feel bad. That is like a mantra that all of us carry with us, either explicitly or implicitly. We may not know it, but it's usually humming in the background somewhere along the way, right? If I let myself off the hook, if I'm nice to myself, if I'm kind to myself, perhaps I'll become lazy, perhaps I'll fall off my game. All of these things are sort of buzzing in the background. And I included this slide because I want to be clear that these thoughts that we're thinking are not our fault or our choice, right? So these thoughts are ingrained for likely a long time, either by society, our past, perhaps they are more natural based on our own genetics. This is an article that I put in almost every single talk because I think it just describes this idea so well, that probably what we're calling, in this case, it's imposter syndrome, but a lot of these well-being outcomes that we measure we should be pointing a accountability arrow at the systems or the society or the culture that really is causative. In this case, this article talks about, of course, women in many fields are struggling with imposter syndrome, i.e., thinking that they don't belong or thinking that they're a fraud, because they've been getting that messaging implicitly or explicitly for probably a century, right? So stop telling women they have imposter syndrome and let's correct the messaging. And what I usually say is, yes, of course we have to correct the messaging. Of course we have to work on racism, sexism, all the phobias, all the forms of systemic oppression that exist. We have to continue to work on those. And also, if those things change, which I mean, I hope they do in my lifetime, but I'm not counting on it based on the pace of change that I've already seen. Even if they do change, we are still left with this whole mass of people that has these thoughts ingrained in their head. And unless we also pay attention to those people aren't going to do better or feel better. And so that's really what we're focusing on with coaching. It is another tool in addition to advocacy, in addition to teaching, mentorship, being a friend. In Better Together, when we're talking about bias, microaggressions, all the isms, we've added affinity or themed calls specifically to address these and to create a safe space. These are calls where people of a certain identified group or intersection show up to a call with a coach that ideally is also of that group or intersection. And it's a space where they, the podcast isn't recorded for everyone to hear. It's really just for them, and they can show up and get coaching around these incredibly vulnerable topics. And so that's where a lot of our coaching requests have come from. And that's where a lot of the cases that you're going to hear today have come from.
So today we're going to focus really on coaching in the DEI space. And this can be quite uncomfortable because we all have our own perspectives. We all have biases that we come up with. And when you're talking about diversity, equity, and inclusion, nobody ever wants to feel like they are not being empathetic or sympathetic or not seeing the full picture, right? We don't want to be like, oh, we're that person, or we missed it, or we said the wrong thing. And so I just want to acknowledge, and what I always do for myself even, is just acknowledge that I have lots of biases, right? And things that I don't even know, assumptions that I make about myself and the world that I live in, and even when I'm interacting with other people. And so we all have that, and that is okay. But what we want to talk about today is there can be some mild trauma that is felt, especially by learners when they're in a situation where there is a hierarchy, right? And so part of what we want to be able to do is, when we're coaching in the DEI space, is really talk about how we can help to empower that learner. And so we'll talk about coaching in the DEI space and really going beyond, I'm sorry that happened to you, right? But realizing that the goal in coaching is not always to feel better, because oftentimes we aren't going to be able to fix it, right? But what we want to be able to do is help that learner be able to process and move forward. And really, I always tell both the coachee and those that are being coached that when you feel isolated, it is really easy to isolate yourself. It's almost like a protective mechanism, right? And when you feel alone, one of the first things that many people do is that you disconnect. And so that can be, though, especially for learners, especially for residents or fellows in a situation where they need to show what they know, they need to be acting as team players, it really can impact their ability to show up as their best selves and really give the information and knowledge that they are learning. And so the idea is that coaching offers a way forward that really acknowledges rather than resists the circumstances, right? And there's going to be lots of awful circumstances that occur in this world that we live in. But how can we still empower that learner to feel like they can control the situation and not have burnout, right? Not be at the effect of whatever is going on. And so one of the things that we talk about is that the cure for burnout is not self-care. It is all of us caring for one another, caring for each other. And we can't do it alone. We really do need each other to be able to move forward. And so we want to talk about this, and we'll go into a case here. And I will tell you, this first case was one that I actually coached a learner on. And so I'm going to present it, and I want you all to kind of open your minds, open your hearts, think about it, and then let us know what you think. So case one, an intern comes to you really upset. She tells you her senior resident doesn't know her name, despite working with her for years. And she feels that the resident is constantly making digs at her and favoring the other interns. And when asked a question by the senior on rounds, the intern's mind often goes blank, right? It causes her to further doubt herself. She waffles on her decisions, and ultimately she checks out from learning and really being integrated with the team. So what are your initial thoughts when you hear about this case? What comes up for you?
Feel free to put it in the chat. Which hat, also, I'd encourage you to look inward at which hat feels the most comfortable to put on, imagining that this resident is coming to you.
Any thoughts?
I'll say my initial
Somebody-
reaction is like deer in headlights. Uh-oh, I'm not sure how to help this learner. Am I required to, report this senior resident? What are the obligations here?
Yeah. And I see in the chat, somebody says, friend hat feels most comfortable to me. Somebody else said, starting with empathy, that sounds painful. Yeah, definitely. And I will tell you, when I started in this coaching, I think my initial reaction was to kind of solve it, right? Like, I am definitely a solver. I want to make everything better. And I think it's very hard to not immediately react and try to solve it or try to smooth it over. And so any other thoughts or hacks that you all would be thinking about? Okay, I think that's all for now. So we'll go on. We'll keep going.
Okay. Friend hat also feels most comfortable to me. And my deer in headlights reaction is certainly getting at what Yashika was saying about, let's solve this. Let's make sure this never happens. This shouldn't happen. Something wrong has gone on. And I want to say that lots of these hats are happening in parallel, or lots of these actions or behaviors might be happening in parallel. So perhaps you are gathering more information. Perhaps you're talking to the supervisor on the service, or a site director, or someone else in order to sort of move your advocacy hat forward. What we want to really zone in on is this coach hat, because this one is, again, pretty uncomfortable, or at least unfamiliar for most of us. The aim in the coaching hat is not to fix, right? So this is where I struggle, and I have to constantly remind myself that when I'm putting on my coach hat, I'm not trying to fix the situation for the learner. Rather, I'm trying to tap into the learner's own inner wisdom that I believe is there and guide them in that direction. The first step to doing this is to bringing awareness to their automatic reactions, right? So we're just going to, again, show them their own mind, non-judgmentally, and then we're continuously asking the question, gosh, is this helpful or not? I will say that because the friend hat is most comfortable for me, I usually get scared that using my coach hat is going to feel unempathetic. And so I will really call attention to what Mark said in the chat, that starting with empathy is always the right move, right? The title of this talk is the now what after I'm sorry that happened to you, right? So the first gut reaction that I think all of us have is empathy and connection and validation. And that's right. That sounds painful. I'm so sorry this happened to you. Just bearing witness is usually the first great step here. And now what Yashika and I are going to move into is what happens after that, right? How can we help this learner beyond empathy? Okay, here's the tool that perhaps you have seen. If you're in Better Together, you have seen it a gajillion times. And I'm so excited to describe it a gajillion and one times, because every time I do, something new happens for me. So the thinking about your thinking is actually pretty frameworky, which appeals to a lot of physicians. And I just want to offer you this tool, which is the tool that we use in Better Together. It is a coaching tool. It is based on CBT, or cognitive behavioral therapy. It has some acceptance and commitment therapy in there. It's just basic cognitive science, y'all. It says that everything in your experience falls into one of 5 categories. Only one is happening outside of your own brain. And that is the circumstance. And by definition, the circumstance is the stuff that happens outside of your own brain. So it's all the data in the world that we're taking in every moment. It is the temperature it is outside, stuff people said to you in the past. It is the color shirt that I'm wearing today. That's the circumstance. Now, our brains are meaning-making machines, and everybody's brain's job is to take those teeny tiny facts, neutral facts, and make meaning out of them. And we do this with thoughts. This is how humans move through the world. They make up a sentence about something that's happening outside of their brain, and then it gives it meaning. Thoughts are what causes something to be positive or negative or neutral for us. And so for me, I chose this shirt in my closet because I thought it was a really pretty pink color that was going to look great. The shirt is just the color that it is. And now I'm looking at myself on Zoom and my brain is saying, oh, that shirt is an ugly color. It's really not what I thought it was going to be. So this is all buzzing in the background while I'm here giving grand rounds. I'm having this model in the background. The shirt is the shirt color. That's what it is. My thought is, that's not the color that I wanted. That's making me feel self-conscious. Y'all, that's what's going on in the background for me. Because of that thought, that shirt looks bad. It's not what you thought it was going to be. I'm now feeling self-conscious. That's fueling my actions. When I get in a super self-conscious state, like right at the beginning of this grand rounds, I was really focused on the shirt color and, do I look washed out? What's going on? Why isn't it pink? Is it the lighting in here? I'm thinking about the lighting. I'm maybe going to like unzip my curtains in my office so that you guys see a different shade of the color, and I'm not focused on introducing myself. And I can't even remember what I said at this point, but I was checked out for it. That's my actions. And because of all that, the result is that I wasn't present for the introduction part of this talk. Y'all, I did not think that that was going to be my current model that I used as an example every time I teach this. Something different comes up, but let me just model some vulnerability for you. That's what's going on in the background for me. This is the thought model. Every result is for the person. It is never a result that someone else does. So it wouldn't be my result that someone in the audience is having a thought about my shirt. I can't control that. That's in their thought model. That's in their brain. My result is what I can control in my brain. Okay, so when a learner comes to us, this is a tool that we can use to take a coach approach to start accessing that inner wisdom or perhaps move them forward. In this case, if we were to plug in this learner's scenario into this thought model, it might look like this. What are the circumstances of that case? In this case, she was I could put female, Black intern. Racism exists, right? We're not necessarily making a judgment call about the other person in this scenario, but in her circumstance is the fact that racism exists in our world today. Also, the senior resident is white, gives you directly critical feedback. You do not see her doing this to your co-intern who's also white. We're staying really factual here. We're not making any assumptions, right? Maybe she is giving it to her co-intern, but certainly this person has not seen it. The senior has not used your name for the whole rotation and consistently uses the other intern's name. She gives you patients with less complex medical problems. So those are all facts happening outside of her brain, theoretically, causing a thought, which we could summarize as she's making digs at me, treating me unfairly, and likes my co-intern more. That thought is causing a feeling of helpless. And that feeling is causing these actions. Now, again, these are all actions that are in her control. That feeling isn't causing anybody else to do anything, but it is causing her to start doubting herself. She's constantly judging the resident. She's now paralyzed when asking questions about patient care. She's not asking for more responsibility. And in fact, she's avoiding the resident and maybe the team as a whole, disconnecting, sort of checking out from learning, right? That's normal. That's a normal reaction to the feeling of helpless. And the feeling of helpless is a normal feeling when you're thinking you're being treated unfairly and there's nothing you can do about it. All of this makes sense. The result, unfortunately, is now in addition to this circumstance, also she's further digging herself in a hole of despair and checking out from learning. I just want to pause and acknowledge reactions that might be coming up for everybody as we put this uncomfortable coach hat on. That yes, of course, the systems should change. Perhaps there is racism at play here. And no, it's not the learner's fault. It's not even her job to help herself here. We're going to start moving this learner into a place of empowerment with the coaching hat. But let me be clear, it's not necessarily her job or her responsibility to do this. It's only available to her as an option if that feels right. Again, yes, we live in an unfair and often unjust world, and still here we are. So if the learner is ready, we are addressing the now what.
And the now what really is about the power in naming the bias and putting that kind of in the C line or the circumstance, right? And when we are talking with the learner and also coaching ourselves, it's looking at the power of really looking at the thoughts and not having any kind of judgment. There's only curiosity. And in the power of permission to not think or perseverate on thoughts, especially when those thoughts don't serve them, right? And you can see for a resident that's in a learning situation, if they continue to pull away from the team, if they continue not to engage, if they continue to not offer, ways to take care of patients or take care of, be involved with cases, it's only going to, in the long run, cause them more pain and suffering. It's only taking away from their ability to thrive and show what they really know. And it's all because of this fee that happened, that somebody didn't know their name, right? And yes, that did happen, but it's about what do you want to pull away from that? What do you want to do so that you can still maximize your experience as a learner, as a resident?
I always tell learners, you might be right. This isn't fair. One of her thoughts in her thought line was, this isn't fair. And it's like, yeah, even if that's true, though, continuing to ruminate about that is actually holding you back. And it's not even touching them, right? You're the one on the hook when you're focusing on this.
Yeah. And so if we look at this model, right, where we have the circumstances, racism exists, the senior doesn't know your name, learn your name, whatever, and your thought is that making digs at me, likes my co-intern more, feeling very helpless. And then, the actions are that they're now starting to doubt themselves, they're judging themselves, they're disconnecting from the rotation, they're trying to avoid the senior. The result really is that there's compound suffering, and it closes off their ability to learn and really highlight what they know. And so the idea is like, can we reframe this? And we're not going to be able to change the circumstance, right? Racism does exist, and the senior didn't know their name for whatever reason, right? That's not for us to debate. But the idea is, what can that learner take away from? How can that learner still show up as their best selves? And, with thoughts like, yes, where they're show up as their best selves and really decrease their suffering. So the idea would be, what would they like to be able to do? What would they like to be able to feel, right? And some of the actions can be about getting curious, and maybe they want to talk to their senior with some curiosity and say, why don't they know their name? Or maybe they said the name wrong, whatever it is. Being able to really say yes to other opportunities so that they can continue to learn and grow as they go through this rotation. And it allows for failure without them having to judge themselves or thinking bad about themselves, right? And as I talked with this learner, one of the things that they wanted to do was feel empowered, regardless of what was going on, regardless of if there might be some racism or some bias, or maybe the resident does like one of the other residents more, right? But if that learner wants to be empowered, what would they have to be thinking? What would they have to have in the back of their mind that allows them to show up in a powerful way and really be able to show up as their best self? And for them, the thoughts are, I can't control that other person. I can't control what they think or believe about me or don't know, but I can control myself, right? And racism, yes, it may exist and it does exist, but in this case, that resident maybe needs to be extra nice to themselves and lean into learning, really, if they want to be able to get something out of this, both out of that circumstance, but also out of their rotation, right? And not allow it to derail their ability to learn and thrive and really show up as their best self.
I love this example of coaching. What we just showed you here is a result model. And so you're asking the learner, what do you like? Look at your result here. Is this serving you? If it's not, what would you like to happen the next time there's racism in the learning environment? Knowing you can't change that right now. There is probably going to be a next time. And so Yashika walks this learner up a result model. How would you have to act? What would it look like for you to be your best self? And what she did that's especially important here is stayed away from toxic positivity, So notice that we're not going to take this learner from thinking, oh, this senior is making digs at me, she likes my co-intern more, to like, oh, I love my senior and she loves me too, right? That's not a believable thought. And if you try to force a learner or even offer a learner that thought that they don't fully believe, what we know is that actually their brain like doubles down on the first thought even more. And so really important here is finding a thought that creates this feeling of empowered that they also believe. And sometimes there's not one that's super available. We'll get into that. But these for that learner are something that the learner came up with that felt true for her.
Can I ask a question about process?
Yes, you're on our questions page, right on time.
So, well, and maybe you're about to do this, but I'm just curious, what's like, are you explicit in, asking like, what are the circumstances? Do you reveal the framework and use that in the discussion, or do you use that after the fact to categorize it?
I think it's such a great question. And when I'm talking about a coach approach to medical educators, what I often will say is I would not necessarily recommend sitting down and going through the CTFAR with a learner. First of all, you aren't necessarily going to have time. A lot of these coach approaching questions happen off the cuff. And so with this one, first of all, then second, I always ask the learner if they would like some coaching around this. And so for Yashika and I, these conversations are happening within Better Together, where the learners know for sure they're showing up for coaching because they signed up for this coaching program. And we have that benefit of not having to say, is it okay if I coach you on this? Because that's what they're here for. When I'm in a learning environment and something is happening in real time, or a learner is distressed in real time, I might pull them aside and say, gosh, start with empathy, offer some suggestions to sort of move the advocacy forward, and then say, gosh, I can see that you're really struggling. Would you like some coaching around this? That means I'm going to show you your brain and we'll decide together if that's helping you or not. And I always ask, I never, ever, ever would coach someone who says, no, thank you. Trust me, if you've ever tried to coach your spouse without them wanting that coaching, it doesn't go well. And so if the learner says, yeah, sure, and if they come to me, they sort of know it already. But I might say, would you like some coaching? Is it okay if I just show you, what's going on using this CBT-based process? They say, sure. So then you may not even have to write this out. You might, but you might think, oh gosh, I hear you thinking that your resident is making digs at you. I hear that. And maybe she is, maybe you're right. But it seems like when you're really thinking about this, it's actually causing you to feel helpless, which is making you disconnect from learning. Is that right? And they're kind of going, yeah, that is right. It's like, oh man, that's so hard. I've been there. Back to validation. That makes sense that you're disconnecting from learning when you're focused on your resident, making digs at you. I wonder what it would look like for you to show up as your best self and not disconnect from learning. And then what would that look like for you might be the question. And so I'm not sharing okay, what are the actions that you would have to take necessarily, but it might just be one question like, gosh, what if it is true that your senior is making digs at you? What else is true that helps you feel empowered?
Thanks. That's really helpful.
And I will say sometimes you can offer them thoughts or feelings, especially when they want to be coached, but they're in a place where they're so stuck on the first model that they can't even process what they would like to show up as or what they would like to do, right? And so I will sometimes say, well, what would you want to get at the end of this rotation, regardless, right? Do you want to learn more? Do you want to do whatever? Or I'll be like, do you want to feel empowered? Because racism is not going to change. So if you continue to experience racism or some kind of bias or some kind of ism, how would you want to react in that moment so that you don't walk away feeling like somebody got the better of the situation or got the better of you, right? And so sometimes if they are stuck, I will try to come in through the back door and be like, what would you like to have said? What would you have liked to have done in this situation? For this particular person, one of the things that they were really upset about was they were mad at themselves and they did not correct the resident. The resident called them the wrong name and they felt like there were a lot of other things going on. But because they were junior, they were like, well, I didn't even correct them. I didn't even tell them that my name is this, right? And so there were multiple things that had then happened and they were really mad at themselves for not showing up the way that they would have wanted to. And so they were kind of ruminating in the same place. And so I said, okay, well, let's just frame it as if this happens again in a very similar situation, somebody says your name wrong, or you feel like there's some bias or whatever, would you like to show up? If you walk away from the situation next time, what would you want to be able to feel? What would you want to be able to do and be like, okay, even though that happened, I don't feel like they got the best of me, right? And so sometimes you have to kind of reframe it to help them figure out like what they would want to do, because it's probably something similar probably will happen again, right? And we can't change that part, but how do you want to walk away from a similar situation and not beat yourself up because you didn't show up the way that you wanted to initially?
Okay, we're going to bring it a little closer to outpatient home. This is a case that has come up in our medical student forum.
So case 2, you are working with an LIC student who missed a lot of clinic days due to illness or personal conflicts. And the school decided that he will need to repeat a month of his second year before moving on to MS3 year due to the many absences. So the student feels this decision is discriminatory and really is against the medical condition or his medical condition. And the student asks for your help preparing to take down the medical school to be able to move forward. And you aren't sure how to help and are also worried about the student's clinical skills, and you're not sure that he should move forward. So the challenge is, can you fill out the model and use a coach approach to create a question to start?
So let's start. Can anybody just shout out or put in the chat what you think the circumstance here is? What is the factual circumstance?
People get sick and it sometimes causes them to miss things.
Yes, that's true. Yeah, student has missed a lot of clinic and is being recommended to repeat a month. This is a student, Emily. So this is a student that has come up and you are in your medical educator role. Oh, and you're coaching the student directly, not the faculty who's having to deal. Good question.
Yeah. So what do you all think? So I think the one thing is just to remember that you're not trying to solve the problem, which, you know, especially because this person is trying to, you know, settle the score, get things, make things better or whatever. And so the idea is, can we take that learner through that situation and help them to maybe understand or have a different perspective about what's going on and not shut down? What does it say in the chat? Oh, student feels discriminated against due to the illness. Yeah, definitely.
Yeah, so Vivian, this is really important. If we were coaching, so Emily asked, are we coaching the faculty member that's dealing with this, or are we coaching the student? If we were coaching the faculty member, that would be the circumstance. You as a medical educator have a student that said XYZ and that they feel discriminated against. That goes in the faculty member C line. When we're coaching the student, or when the student comes to one of us and says, help me with this, I have to move forward, I can't believe the school did this to me, their feelings actually go in their F line. The circumstance is simply more of, you know, the school made this recommendation and you've missed this many days of your month. Now, what do you think about that is causing you to feel discriminated? Yes, repeating a rotation has implications. Absolutely goes in the C line.
Yes.
Yeah.
Definitely.
And again, the system's flawed. Maybe we're all having all kinds of thoughts, right? All of us are having our own models about the student and what we would do in this situation with our own LIC student. Maybe some of us think, the medical school should be, you know, much more accommodating and it shouldn't have implications if you need to repeat a month. It shouldn't set you a whole year back, and perhaps it does. We have all sorts of ideas about what should or shouldn't be happening. And whatever is happening is, right? The system is flawed. Perhaps we think, oh my gosh, that student should totally have to repeat, maybe even a whole year if they're going to be sick that much. How are they possibly going to become a doctor that can practice in the world. We have all of our own thoughts. Whatever that is, though, just is. So something that's really helpful for me before I coach someone, again, I might ask the student, okay, like let's gather some information. Let's find out what the implications are. Let's decide how you want to proceed. But before we do any of that, can I coach you on this? Let's just see what your brain is doing and if that's helping you or not, as defined by you. And something that I do personally before I sit down and have that conversation is I might do my own free write journal entry just to see what my thoughts are about the situation, knowing that in a coaching conversation, my thoughts are irrelevant. Again, when I'm a teacher or a doctor or a mentor, my thoughts are relevant. My opinions are relevant and possibly helpful. When I'm being a coach, my thoughts are irrelevant and probably not helpful because they're not helping me create that neutral space. So I can't know what my thoughts are most of the time unless I get them all down. And sometimes, I'll allow myself to have like the worst thoughts that possibly come up. What are the ugliest biases that I'm having about this? What do I think about this learner? What do I think about this school? What's all there? And then I'll just physically set it to the side, or maybe I'll rip it up and put it in the trash can as a sign to myself, like you're entering this with a clean slate. And then I would help the student again, just see what's happening in their own brain. You're thinking, this is unfair, it's discrimination, and it shouldn't be happening. Again, a feeling of helpless comes up. Again, notice the thought of this is unfair. This is a theme when we're coaching learners or each other on any type of bias that they're feeling. This will come up time and time again, usually causes a feeling of helpless, which again causes them to disconnect from learning, right? It usually, this learner doesn't know what to do, is judging others, is starting to disconnect from the rotation. They were considering quitting med school. And specifically had told me they went to their LIC director meeting angry and accidentally yelled. And now, again, similar to the last learner, like didn't show up as they wanted to. So when we're thinking of reframing this, once again, we're not in the business of changing circumstances. The circumstance just is. And I might even say, gosh, with your medical condition, you're probably going to miss more days. In fact, you may miss more days in third year. You may miss days in residency, and those might have implications also. So let's just think about this. The next time this happens, what do you want the result to be? I said, okay, well, I'd like to show up as the best version of myself and not compound the suffering if this is going to happen again. And then asking again, what does that look like? And this is important to have them come up. I would say, what would it look like to show up as your best self? And they name the actions. Just like Yashika was saying, they may not be able to even know what that looks like. And so you might use these actions over here and say, okay, well, it seems like you didn't like how you showed up in that meeting. What would be a different way? What would you have been proud of? And maybe they're like, I don't know, maybe if I just stayed quiet. And it's like, okay, yeah, well, what if you just showed up with curiosity? Would you be proud of that? And they say, yes. So then you add that to the action line. And then again, they're still advocating in this model. They still sort of don't like or don't want to accept the med school's decision. And that's great because to them, that's showing up as their best self. And so in this new model, they're still advocating as they see fit, right? How do you have to feel? There's that word again. A theme is coming up. So really, when we're coaching in the DEI space, we're helping people move from helpless to empowered. And now comes the real sort of magic of coaching. And this is zeroing in on the T line. Again, I'm not taking this learner from this is unfair, it's discrimination, to this is totally fair and I love it. I'm happy to accept it as it is. Not useful, not true for them, not believable. Where we landed was that, unfair things happen, period. And you might start there and not go any further at all. It might even just be, this is unfair and unfair things happen. I can still choose how I want to show up. Similarly, this is discrimination. I'll need to lean into learning and advocacy if I want to get something out of this, right? It's still an option to not. It's still an option for them to go into helpless mode or defense mode. But if they want to get something out of this, they're probably going to have to change something that they're doing. So here we're just exploring and we're just naming, this is unfair and unfair things happen. They're going to continue to happen to you. Everybody can agree upon that. That feels a lot different than focusing on how unfair it is. What are your reactions to this case or questions?
I have a question. Hi, Tyra and Yashika. I love the concept of the result to show up your best self and lessen suffering. It seems to me that it requires being available for coaching to even get to that space, because I wonder if the result is something different. Like, I am angry and I would like the system to change. Like, what do you do when that's the result that's wanted?
Remind them that the system is a circumstance and they're not in control of anyone else or anything else. So it is a constant space of reminding someone that the result is only about them and how they show up and how they act and how they can feel. We can never control what's happening out there. We can move towards that again.
Yeah.
And probably this second model is closer, right? We're advocating from a curious, steady, empowered space rather than considering quitting and yelling at everybody.
For sure.
But again, even here, there's still going to be system problems.
Interesting. Is that obvious to the person being coached that is, do you know what I mean? Like, is that an easy sell or a tough sell?
No, it's a tough
No, I don't think it's an easy sell, but I tell them it's just a fact of life, right? Like, we can argue all day about, is this right or wrong? But in the moment, it's not helpful. It's like, you are a student. This is the rule. This is what they've decided. You can't fight the entire system, right? And so, yes, we may want things to change, but right now, this is what it is. What are we going to do with what we have available?
That is so
And go ahead.
That's really concrete and brilliant.
Yeah, I mean, because I think sometimes you just have to have them acknowledge, like, it is what it is, right? It's like, yeah, racism exists, or gender bias exists, but we can't change that today. And we can't wait until it changes. But if you want to be able to move forward today with what we have, what do you want to do today, right? And that's my thought. I'm like, yes, all of this other stuff exists, and we may not like it, and that we may hope to change now and in the future. But right now, with what I have, what do I want to do for myself? What do you want to do for yourself, given what you have, so that you get out of this situation, whatever it is you need to get out of, or you show up as the person that you would like other people to see, right? And I'm pretty sure, like, we don't want to be that person that's screaming and yelling. Actually, is not very helpful. Even if you are correct, you are never going to move forward by yelling at anybody. They're gonna tap out, right? And sometimes I tell them that. I'm like, yes, you had a great something to say, but nobody listens when what you're saying is being yelled at them, right? So even if you want them to hear your words, you have to show up in a certain way for them to even be open to hearing what you're saying.
Laura, I see your comment in the chat, and I struggle with this also. As a person in this situation where the system most often privileges me, it's harder to tell people this is just a fact. What I use here is really leaning into validating the emotion. And so a lot of the times the emotion is anger, helpless, whatever it might be, frustrated. But a lot of the time it's somewhere in the anger variant. And I usually lean into that and say, of course you're angry. And in fact, anger is not bad. You probably want to be angry that this is happening. We all want to feel, we're not robots. We don't want to feel happy when somebody is hurt because of oppression. And so that anger is useful and it's pointing to a value. But when you are acting from your anger, look what happens. Like, this other person isn't changing. And in fact, you're compounding your own suffering. And so I want to help you use that anger. We're not getting rid of the anger, but can we use it to empower you rather than disempower you? And so, yes, racism exists. We both agree it shouldn't happen. Anger is super useful because within that anger is your answer. I want to be angry about it. I'm sure you want to be angry about it. I can't understand what it's like to be you, but I know what's happening from your anger isn't helping. It's really nuanced. And I would say that something that I have learned in the last 4 years is that if I bite my tongue because I'm afraid that I will look like an idiot white lady who doesn't get it, that's actually more harmful than just being much more open about this and showing someone their mind. We are out of time. And so I just want to call attention to this tip that Shika has told me many, many times around priming when we're about to do this.
Yeah. And I think I usually just tell people that, we are going to ask questions, but I am not questioning them or the circumstance. You really have to let them know I'm on your side. But part of what we need to do to be able to move through it is ask questions of ourselves to really figure out how we want to show up and what we want to happen. Right. And I always will tell them too that in that situation, if something comes out wrong, I kind of apologize ahead of time, but also call me out if it sounds like something that is triggering or does not come across correctly, that they have the ability to tell me in the moment, right? Because we're all human and we all have those biases. So it's you kind of want to also let them know that can happen. That is not my intent.
Yep. Yeah, I just want to end by saying sometimes more hats are needed, including mental health hats that a lot of us don't even have access to. And oftentimes, if you sense this, the beauty of being a physician when you're taking a coach approach is that you're also a physician. And so sometimes this is a space where we can offer more resources. Okay, y'all, this always is a huge topic for discussion. And if you have questions, Sheik and I will be on it for a couple of minutes. We're so grateful for your time and attention and happy to answer any questions. This is just a QR code to the website. $901, we did it.